Hello. So today I'm going to try to answer a question about heartworms that I hear quite frequently, and that is, why does my veterinary hospital require heartworm tests every year to give heartworm prevention? Now, not every vet clinic is going to do this, but it is very beneficial to do an annual heartworm test for dogs, even if you've been incredibly diligent with prevention. And there's a couple of reasons why. Number one, heartworm prevention is not 100%. It's possible to give the pills and your dogs still get heartworms. It's also possible, I have seen dogs before that are incredibly sneaky at hiding the pills. I had one patient that popped positive on the heartworm test, and when they investigated and they ended up moving the couch, they found all the heartworm pills for the past 7 months there because the dog was going under the couch and spitting them out. So it helps you find out, one, if they're not getting it, or two, if we're just one of those dogs that had a breakthrough or resistant infection. Another benefit of doing a heartworm test once a year is we're never really going to know if a product is starting to fail without doing that type of testing. And that goes for every product out there. Any injectable, topical, oral prevention, we will never know if there was a manufacturer error, if there's pocket of resistance, if there's any of those things without testing patients for heartworm disease. Now, the one that I think is the most important is a lot of our heartworm preventions in the product guarantee it is directed that the pet needs to have an annual heartworm test, which means if you give your pet one of those products that it's required and they're on the product and everything goes fine, and then something messes up and they end up getting heartworms, that manufacturer may not help you with treatment. Whereas if you stay within the product guarantee, a lot of those manufacturers will either pay for all or most of heartworm treatment since they back their product. So it can be kind of annoying, but it's worth it to do the annual test. And if you need to do it at a vaccine clinic so it's a little bit cheaper and give the results to your veterinarian, rock on to your thing. If you need to request just a heartworm test rather than the 4 tests, which is heartworm and 3 tick diseases that a lot of clinics do, you can do that too. But the annual heartworm test is pretty important. There are some clinics that will allow you to sign a waiver to not do the heartworm test, but that waiver is essentially protecting the clinic. If the prevention fails and the product ends up not being guaranteed, you can't really bring it back on the clinic. I get asked that question all the time, and it's not just a monetary thing. It's not us trying to pay our bills or keep the doors open. It really is the best way to protect you and your pet to do that test annually. Also, if we miss any prevention, it is suggested to test 6 months later. And there are some manufacturers that if you're switching preventions, they would recommend to test in another one 6 months later to prove 100% that the dog is negative when they start the prevention, since the test doesn't test the last 6 months of the dog's life.